Good afternoon, and thank you for joining us today. Before we begin, I would like to note that the views expressed in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. Next slide. My name is Adelicia Carrillo, and I have the privilege of serving as Project Co-Director for SAMHSA's United Aid Crisis Systems Response Training and Technical Assistance Center that is operated by Altera. Now, let's take a moment to ensure that everyone in the audience is ready and comfortable with the technical aspects of the webinar. I will now turn things over to my colleague, Kaylee, to walk you through the webinar interface, including how to submit questions and other technical information.
Thank you, Adelicia. As you will see, closed captioning is enabled for today's webinar. We also have American Sign Language capabilities, and you'll see the interpreters are spotlighted throughout the presentations. If you need any technical support during today's webinar, please reach out using the Q&A function, and I will address it for you. Lastly, if you have questions for the presenters during webinars, during the presentations, please submit those during the Q&A, and we will address them as time allows after the presentations are over.
Thank you, Kaylee. Next slide. Today's webinar is intended to discuss the importance of designing crisis services to create a structure or continuum of care that meets the needs of any person experiencing a behavioral health crisis by utilizing best and emerging practices, a client-centered approach, and cross-system collaboration. During this webinar, the United Aid Behavioral Health Crisis Coordinating Office will share information on the recently announced Policy Academy on Systems Design. After attending this webinar, attendees should be able to understand the impact of creating a crisis continuum of care that can meet the behavioral health needs of any individual in crisis, conceptualize challenges and identify solutions around crisis systems implementation, and identify resources available for crisis system engineering. Next slide. Before we start our presentation portion, I would like to introduce Jill Mays. Jill serves as the Division Director for Crisis System Transformation for the United Aid and Behavioral Health Crisis Coordinating Office at SAMHSA. She currently leads the evolutionary and collaborative work of Pillars 2, Someone to Respond, and 3, A Safe Place for Help, of the United Aid Behavioral Health Crisis Continuum. Before coming to SAMHSA, Mrs. Mays served as Director of the Office of Behavioral Health Prevention and Federal Grants at the Georgia Department of Behavioral Health and Developmental Disabilities, where she most recently oversaw all substance misuse prevention, suicide prevention, mental health promotion, and behavioral health equity strategies, and served as principal investigator for the agency's multi-million-dollar portfolio of federal grants, including United Aid and CCBHC grants, and as planner for the Mental Health Block Grant. Additionally, as Assistant Director of the Office of Adult Mental Health at DBHDD, she was the Project Officer for Crisis Services. Mrs. Mays previously coordinated operation of SAMHSA's Disaster Distress Helpline Core Regional Call Center in Atlanta, serving FEMA Regions 3 and 4. Mrs. Mays is a licensed professional counselor with over 30 years of experience in the behavioral health field and is a person with mental health lived experience. At this time, I will hand things over to her for a brief welcome and to introduce our guest speakers.
Good afternoon, everyone. We are so excited that you joined us today for this webinar, and we're just thrilled to have your participation and looking forward to those of you who plan to apply for the Policy Academy. We are planning 2 really robust days of information to help with systems design. And those of you who attend the Policy Academy will hear more about kind of my Lego analogy. There's so many moving pieces in developing the crisis system, and we want to talk about how to put those pieces together in ways that are seamless and that offer the best access and the best quality care for the individuals who we are serving. So more about the Legos at the Policy Academy. But today I'm joined by a panel of speakers, and I'm going to take a moment to introduce them, and they're going to help us to understand the importance of crisis system design and really being very strategic and thoughtful about that. So I'm joined today. Our first panelist is going to be Annette Crisp. Annette is a graduate of the Respect Institute of Georgia, and the Respect Institute supports participants in developing the skills necessary to transform their experiences of mental health and substance use challenges and cross disabilities into educational and inspirational presentations. And I know that you will feel that same way by the time Annette has shared her story with us, and we feel very privileged today to have Annette with us. Our next presenter is Monica Johnson, and Monica is the director of the 988 and Behavioral Health Crisis Coordinating Office. Ms. Johnson has worked in the behavioral health field for 26 years and most recently served as the interim commissioner for the Georgia Department of Behavioral Health and Developmental Disabilities. Prior to this role, she served as the division director for the Division of Behavioral Health for 8 years, the Community Mental Health Director for 3 years, and the Child and Adolescent Mental Health Director for 1 year. Ms. Johnson's key responsibilities during her tenure with DBHDD included leading a team of executive directors for the offices of adult mental health, addictive diseases, children, young adults, and families, deaf services, recovery, prevention and federal grants and cultural competency, field operations, and crisis coordination. Functions in these roles included strategic planning for all community behavioral health programs, the development and oversight of behavioral health policies and practices, program development, and workforce development. Ms. Johnson is a seasoned executive leader with a proven track record of success. Over the last couple of decades, Ms. Johnson has led the formation of high-profile change initiatives, chaired collaboratives, and served as a board member for a variety of governing boards. Following Monica, we will hear from Dr. Brian Hepburn. Dr. Hepburn became executive director of the National Association of State Mental Health Program Directors in July of 2015. Prior to joining NASHMD, he served 13 years as Maryland's Mental Health Program Director. In his role as Maryland State Mental Health Director, his priorities were systems integration across a continuum of care in managing a budget of approximately $1.1 billion, covering 5 hospitals, 2 regional institutions for children and adolescents, and community services for approximately 155,000 individuals, 45% of whom were under the age of 21. During his time at NASHMD, Dr. Hepburn has championed the work of Beyond Beds in both papers and through the transfer initiatives, the TTI initiatives that many of you may be familiar with. He's extremely proud of the work done by states and territories, particularly in the area of promoting the continuum of care, suicide prevention, and 988 crisis services. Following Dr. Hepburn, we will hear from Robert Morrison. First came to the National Association of State Alcohol and Drug Abuse Directors, or NASADAD, in 1998 when he worked on legislative and regulatory affairs as public policy associate. Robert then served as Associate Director of Governmental Relations at Smith, Buckland and Associates from 1999 to 2001, where he directed government affairs programs for healthcare organizations, including the American Psychiatric Nurses Association. Rob returned to NASADAD in 2001 as Director of Public Policy and went on to become Executive Director in 2009. Rob first came to Washington in 1993 to work for the late U.S. Senator Frank R. Lautenberg of New Jersey for approximately 4 years. Robert graduated from Drew University in New Jersey with a BA in political science and completed graduate work in American government at the Johns Hopkins University. With that, I will pass things over to Annette to get us started. And thanks again, Annette, for being with us today.
Yes, ma'am, it's a privilege to be here. Thank you. Good afternoon. My name's Annette. I'd like to share my story of becoming an Ironman with you. I had a really happy childhood with a loving and stable family. I enjoyed being a kid and have great memories. My family was supportive and available. I remember as a child seeing video footage of Dick Hoyt pushing his paraplegic son, Rick, in an Ironman triathlon race that consisted of a 2.4-mile swim, 112-mile bike ride, followed by a 26.2-mile marathon run. I knew someday I wanted to do that too. After college graduation, I had my life together with a job in my field, house with a college friend, and the Jeep I'd always wanted. At the age of 24, everything in my world fell apart when a relationship ended. I felt like I couldn't do and learn my new job. I was overwhelmed with the poor financial decisions I'd made. I remember crawling into bed when I got off work and lying in the dark for hours, wishing I was not alive and wanting some way to take away the pain and confusion. I'd taken on too much, working 3 jobs, volunteering, mentoring youth, busy with friends and athletics. I went to one of my jobs at a University of Georgia football game and walked to the top level of the stadium, wanting to jump off. No, I wasn't going to do that. My mind was so unclear. I just left, went home, got on my bike, and rode, imagining riding cross country and competing in an Ironman race. Then I went home and laid under the couch with its weight on top of me. I was hurting and hearing voices screaming in my head. I wanted to escape and hide from the world. Monday morning, rather than go to work, I drove to my parents, dangerously, barely able to see, without having put in my contacts, and hid in their basement. I was catatonic for several weeks and diagnosed with post-traumatic stress disorder, my first time seeing a psychiatrist. For about 8 months, I lived isolated from everyone. Eventually, I started to feel better and wanted to live again. I was feeling really good, with an abundance of energy and an invincible feeling I could do anything. Then, at 26, I was diagnosed with bipolar disorder. The following 2 years were a roller coaster of instability. I was mostly manic and very out of touch with reality. A few times I'd feel better and try to work again. Then the mania started to come to play. I was not sleeping much. My mind had become full of ridiculous delusions. Once, I went to the labs at the University of Georgia campus and at a private lab where I'd worked and taped a jungle of papers everywhere. I wrote nonsensical things on the walls and mirrors. Lab equipment and clothes were thrown about. I was trying to sort out what was happening and how to get away from everyone that was after me. It was a mess, scattered and disconnected. The cycles of being manic that led to hospitalizations were exhausting. In the hospital, I was over-medicated to the point I couldn't walk, and sometimes woke up during the night having wet on myself, unable to turn over. My family didn't know how to help me. I constantly burnt bridges and blew things up. I was not able to have a stable place to live and do life because of my troubled mind. Those times I spent wandering on the streets with nowhere to go, how was this me? Marrying and having children was something I really wanted. Now, that seemed impossible. I'd become overweight, lost my self-esteem, had been rejected by my friends and family, having hurt them in manic states. I was miserable. In my mind, things were over, so I attempted suicide. In the hospital, I was connected with the Assertive Community Treatment Program, and they truly put me on the path to get well and stable. I remember my case manager asking me, what did I need to get better? I told her I needed my own place to live, and she made that happen. They provided me with the structure and accountability that allowed me to finally experience recovery. Shortly after, I was able to attend the Georgia Peer Support Training. Completing that was pivotal in my healing journey. It taught me how to successfully live with my diagnosis and put a level of stability in my life that allowed me to marry and have children. Setbacks have occurred in my journey. Living with bipolar is tough. I've spent about 1 year cumulatively in mental hospitals, had an abusive husband, and hard divorce. I've been able to turn my challenges and life experiences into strengths. I have learned consistency is the key for me to staying well. So every single day, I get enough sleep, eat healthy, take medication, exercise, pray, meditate, have mentors, and write in my gratitude journal. These things have become a habit and have allowed me to live a fulfilling life. I did get to do my Ironman recently in Chattanooga, Tennessee. Running over the walking bridge across the Tennessee River on the second loop of the Ironman run really was a monumental moment for me. I looked at the park bench along the river as I ran by where my ex-husband had proposed 13 years earlier. It was closure for me. The ending of that chapter in my life. I was completing the 15-hour incredible journey, making my way to the red carpet finish line. To hear the words I wanted for over 20 years. Annette, you are an Iron Man. Now, I'm focused on raising my 2 amazing young children. I spend most of my time making a great childhood for them. I plan on getting more involved with NAMI and peer support. I want to create something of value in the recovery space and develop resources. I've been able to present several times with the Respect Institute. What interests me most is researching how intense exercise is a healthy outlet for healing and recovery. Some of the things I've been able to do, like owning a home and having children, I was told I could not do, even by my family and people that love me. I want to motivate others to believe, as the Ironman slogan says, anything is possible. And as Dick Hoyt said, Yes, you can. A few of my life goals are to speak on and advocate for mental health and domestic violence. I want to live out my life's purpose by being a professional speaker and educator and acquire the credentials necessary to have a platform. I will speak at a TED Talk. In 9 years, to get to a level of financial independence, to be able to travel on cross-country bike tours and be a whitewater rafting guide on the Ocoee River. Along the way, to be an encouragement and offer hope to people across the country through sharing my story. I want to serve and do the adventurous things I really enjoy. Advice to my peers: don't limit yourself. You have way more potential and ability than you think. Use your mental health diagnosis as a strength. You're, in a sense, an Iron Man. You can fight and achieve wellness and get the life you want. Leaders in behavioral health systems, what you do matters. The people you are seeing, you are making a difference. Even though sometimes you may feel like you are not reaching patients, they will remember that you cared and listened. Don't quit striving to be your best. Thank you for serving others and doing what you do. Thank you for listening to my story.
Thank you so much, Annette. And I'm going to give you a round of applause that I'm sure is echoed throughout our whole group of participants today. You have really inspired us and given us a lot to think about. And yes, Annette, you are an Iron Man. And I want to point out for our participants today a couple of takeaways from Annette's incredible story of her journey. And the first is, anything is possible. The second is, yes, you can. We hope that you'll remember that as you begin to think about systems design. And another important point that Annette gave us is, do the adventurous thing. This is going to require us thinking outside of the box to put together this transformed crisis continuum. So think outside of the box. And finally, I hope that you heard Annette say what we here at SAMHSA think as well about all of the work that is happening all across the country. What you do matters. Thank you again, Annette, for being with us and so bravely sharing your recovery journey. So now we're going to shift. I'm going to turn things over to our director, Monica Johnson.
Thank you, Jill. Annette, before you go, I hope you can still hear me. Thank you so much for your story today. I love when we start meetings and conversations with the why. And so thank you for reminding all of us of why we are having this conversation today and why we are showing up in the spaces that we are. So just thank you. And you're going to meet all those goals. I'm positive. So good luck to you. So I get an opportunity to, can we advance the slides? I get an opportunity to talk a little bit about why obviously the Policy Academy is important, but I'm going to lean into a space of just talking about and kind of lifting up what's happening right now in this ecosystem. We can advance to the next slide, please. So as we go ahead, I'm sorry, one more slide. I'm not doing that, keep going. All right, so I want to start here. So what's most important, and as I sit and reflect, listening to Annette and thinking about the why and thinking about the reason why we came up with wanting to do this Policy Academy, is because what we know to be true are a couple of things. I'm approaching my 1-year anniversary here in this role, and have learned quite a bit over the last 12 months from this seat. And what I know to be true, nobody can tell me different, is that 988 has been the most transformative thing that has happened in behavioral health in decades. That is true. But then what has also happened as a result of 988 being implemented is it has become a catalyst for significant rapid system change. So again, if you've heard me talk before, you've heard me point this out. There is no state, there is no territory, there's no, every tribal community and nation, every corner of this country and in all of our territories, you can find that leaders are talking about how to transform their behavioral health crisis systems. When I speak about behavioral health, I am talking about all the things. I am talking about mental health. I am talking about suicide prevention. I am talking about substance misuse. I'm talking about all the things, right? And so this is an amazing moment in time. So you have that, that's good news. But then you also have the reality of the complexities of what it really means to do system change so that we can realize the promise of 988, which is obviously everyone can recite this together now, I hope, but a place to call, someone that can respond to you if that is what is needed. That may look like mobile crisis, can look like other things, but we typically think about mobile crisis beyond the call, and then a safe place to receive help if that is what is needed. In order to build out these type of systems, it is going to take creativity, it's going to take being adventurous, it's going to take bold leadership and bold movements to be able to really visualize and really get to seeing what we know is possible. And so we're looking to find across the country, teams that can come together and really put their best efforts forward to really demonstrate how this can be done. So as we look at this, we can go to the next slide, please. So when I talk about this, just as context, because I think the context is important, we're experiencing rapid growth. And I'm not just talking about you all that are listening to this. I'm not just talking about one particular entity. Everybody that is tied to this space, rather, is SAMHSA. Our office is new. That is growth, right? We're a little over a year old as an office, but we're growing. Everything is bigger because of the catalyst in the gift that we have, in which 988 is. So it's requiring new relationships that didn't exist before. It's requiring the states and territories and tribal leadership to play maybe a different role that they had not played before as it relates to the contact centers that are within the states and territories. It requires different relationships related to our Lifeline Network administrator. There's a whole bunch of activity and everybody is looking around like, how do we get all this done? And so we can relate to that. And so this is just really us being real. I think just having an honest moment to reflect about how complex this work is, but how do we push through that and come out on the other side of this so that we can build a better system for our grandchildren and those that will be but here when we are all gone. Next slide. So there's been a huge infusion in funding. I don't know how long that will last, but we have to take advantage of these moments in the time that we are in. This is a federal state partnership. It requires collaboration in terms of finances. It requires collaboration in terms of policymaking and training and all those types of support in order to see this vision through for the long haul. Next slide. So I won't spend a lot of time here. You will have these slides. There's a couple of slides that speak to the different roles of the administrator. Vibrant, in this case, is our Lifeline administrator, what they're responsible for. And I want to skip to the next slide. This slide is where I want to stay for a second, and then I want to turn it over to the rest of our panel because I want to make sure we get time for Q&A. So this slide is important to me because it really does, I think, a good job of articulating where states are. Where is the system right now? So a year and a half later, post 988 implementation, what do we know exists? So I've kind of made 3 buckets of categories in which I feel like states and systems either fall. So either you're a really progressive, advanced system, meaning that you've already kind of been doing this work for a really long time. You have mature systems in place. You have like statewide mobile crisis coverage. You already have robust technology related to your contact centers. You already have interface around working with law enforcement and 911 collaborations. You already have dual expertise in terms of individuals with not only behavioral health, but also intellectual developmental disabilities, to just name a few, and some specialized populations. So you may already have good funding and legislation that supports your.
I think Director Johnson is having some technical difficulties. What we would like to do now, until she is able to come back, is to go ahead and go with our next speaker.
I made it. I'm back.
Oh, you made it back. Okay, thank you.
Yes, the devil is a lie. I'm back. Okay, so I don't know which I heard last. Can somebody tell me, what's the last thing you heard? I was talking about competent systems. All right. And then the third bucket would be novice systems. And there's nothing wrong being in this space. Novice systems are newer to the space. They're just getting to know. So maybe the state behavioral health authority is just really getting to know their contact centers. They're really just forming these collaboratives. They're ripe for learnings, right? And so no matter where you fall, we recognize that the support is needed to make sure that we can get to realizing the vision that we have for our system. So with that, next slide. Yeah, so with that, I really want to turn it over to Dr. Hepburn, and I want you all to hear from Rob, because I think it's really important to have the collective voices heard, and I'm not going to let my internet do what it just did again. So I'm going to wrap up and turn this over to Dr. Hepburn. Thank you.
Thank you, Monica. And thank you also to Monica and her team, Jill. It's been really helpful to have the federal leadership by SAMHSA on the 988 and crisis services over the last few years. And Monica has done a great job over the last year of working with her team and helping us in this, what I think is a movement. And I agree with what Monica described. This is truly, I'm an old guy, this is truly I think the most important thing that's happened in mental health over the last 30 to 40 years. So thank you to Monica. And I also want to thank Annette for sharing her story. I know that it was she had a difficult time in her life, and the fact that now she's willing to share it is what really makes a difference and helps, as Jill said, to inspire us to try and make a difference as we all go forward. So my first slide, please, or second slide. And as Monica said, I'm Brian Hepburn. I've been working in mental health for a long time. I'm a psychiatrist, have been with NASHBID 8.5 years. And prior to that, I was the commissioner in Maryland. First time I worked in crisis services was in 1979. So that gives you an idea of how old I am. And the reason I bring it up is that our crisis services back then were not sustainable because we could not afford to continue them. So even though there were a lot of good things that were happening back there at that time, and we had good models, we did not have the funding sustainability. So I want to talk a little bit about NASHBID, Beyond Beds, crisis services, and beyond crisis. Next slide, please. So the National Association of State Mental Health Program Directors, we represent the public mental health system, serving people in all states, territories, and the District of Columbia. Our goal is to try and improve mental health, substance use services, IDD in all states and territories, but our main focus is on the mental health side. Next slide, please. So states are focused on increasing access to community-based services, including successful 988 implementation. They focus on a robust continuum of mental health has been in the States for a number of years. We really started prioritizing this through our Beyond Beds papers in 2017. Our papers are all available free of charge on our NASHBID website, and I think you can get anything you would want related to the continuum of care. The last couple of years have been focused on 988 and crisis services. I think it really gives you a nice compendium of almost anything you would want related to 988 and crisis services. We know the pandemic exacerbated the effects on mental health for everyone. And with the implementation of 988 that occurred on July 16th, 2022, the need for high quality crisis services is at an all-time high. The essential elements of an effective crisis system include regional, statewide crisis call centers that are coordinated in real time, centrally deployed 24/7 mobile crisis receiving centers, and crisis stabilization programs, including crisis beds. States have turned to SAMHSA for national guidelines to expand their crisis systems. Next slide, please. This document was put out by SAMHSA. Every state and territory is using it. And I know SAMHSA is going to be working on how to improve on this with the second version. For right now, though, I think it gives you a good starting point for best practices. Next slide, please. So state priorities. Number one state priority right now is having a successful 988 and crisis care continuum. This includes sustainable funding opportunities, and I want to underline that, sustainable, and technical assistance from the federal partners. We know that currently there's braided funding, and there's a lot of money out there, as Monica described. The fear is 5 years and beyond, we won't have that same funding. And this is a very important issue to try and address. So funding concerns are a priority. Concern about how the unwinding of Medicaid is going to impact ability of individuals in some states to be able to get 988 and crisis services. The IMD issue is also very important, trying to make sure that individuals who are in an IMD still are able to use their Medicaid. Workforce, we know retention and recruitment efforts are going on in all states. And as Monica talked about, changing the system, which is what we're trying to do with all the movement, will also change the workforce needed, so that if we can keep people in the community with a good continuum of care, with effective crisis services, we can decrease the workforce demands at the higher level in inpatient and those type of services. We can also keep people out of jail, which will impact workforce as well. The CCBHC model is very helpful in terms of helping with the workforce, and technology through the Oklahoma model is also helpful. Children's services using the Connecticut model is also very helpful. Next slide, please. Peer support and recovery, looking at how we can get payment for peers and how we can include them in the workforce and utilize the services through payment from Medicare, Medicaid, and private payers. Trying to make sure that parity is done, trying to make sure that telehealth is continued. Next slide, please. So what is the promise of 988? 988 will be as effective for behavioral health crisis as 911 has been for physical health. That the combination of 988 and Crisis Now model of crisis services will connect individuals at the level that's needed rather than the level that's available. That law enforcement will only be used where safety is a concern, and that fees to provide financial stabilization for call centers will be accessed. If fees are not used, then other forms of sustainable funding will be found. Next slide, please. So the goal is 988 Suicide and Crisis Lifeline. No matter where you live in the United States, you can easily access 24/7 support. Being able to call or text 988, being able to say, we're here for you. we're not going to be able to do this overnight. We're not going to be able to do it with a flick of a switch. It's going to take years, just like it did for 911. But it is a movement, and we need all of you. And the Policy Academy is a nice way of being able to work together in order to accomplish that goal. Thank you very much. And now let me introduce Rob Morrison as the next speaker. Rob is the Executive Director of Legislative Affairs and the National Association and the CEO for the National Association of State Alcohol and Drug Abuse Directors. Rob?
Thanks a ton, Brian, and thanks for your insight. I too would like to thank our SAMHSA colleagues for this call. The work of Dr. Miriam Delphin-Rittman as a leader of SAMHSA, and Monica Johnson leading the 988 Crisis Office. Thanks to you, Brian, for your partnership across a number of categories, but in particular, 988 and crisis services. And I want to recognize the Training and TA Center for this call and the work upcoming. And thanks to you, the folks on the call who do the work. We don't have to tell you how much of a large task this has been and how much work lies ahead. As Brian said, I think that first call to 911 was over 50 years ago in 1968, and we see how long it took. But the amount of work that's been done in such a short period of time on 988 and crisis services has been impressive, and we thank you for that. And we are making progress. And I think we're making progress because, quite frankly, your determination to make things better. And in addition, I think we're making progress because you're expanding your team. You're expanding the number of partners that you're working with at the local level, at the state level, and as we've all seen at the federal level. I also like to add that I believe progress is being made because we're engaging in systematic and deliberate communication, like this webinar today. And these themes, they form the basis of how policy academies work, how they can help maintain momentum, unpack tough issues, and enhance planning or priorities that you have in your state. And to be successful, I think we all know that initiatives like a policy academy, they have to meet states where they're at because they're different. And states are in different places, as Monica said, on crisis services as well. So a tailored approach is key. And I think the training and TA center staff members, they understand this. And they want to listen and have something that works for everyone. And I know that their outreach has been key in setting up this call and also the work ahead, because they know we need to enhance your work, not recreate the wheel. And as you think about this Policy Academy opportunity, we know there's work needed on a number of fronts. And we know, for example, there's work to ensure the unique needs related to substance use disorders, that they're recognized and addressed. And this begins, of course, with the buy-in that our premise is that when we're talking about 988 crisis services, we're talking about substance use disorders as well. It needs to be identified, articulated, and promoted in a very distinct, visible, and vocal manner. Now, we know you understand this. You've been promoting this, but we also know there's work to be done with the general public. And we've seen examples of you all working to change this. And part of what we do in a policy academy setting is to share different approaches states are taking to improve and solve problems. Over the past few years, I've had the privilege of seeing this work up close and in person. And this has taken place in a number of states through site visits. But we've also had convenings, data and documents Brian referenced, and through that information, we know work has been supported in large part through SAMHSA funds designed specifically for 988 and crisis services, and those are critical. But we also know states are leveraging other resources to help bolster crisis work as well. The State Opioid Response Grant, or SOR, for example, has been an important resource for crisis services. We know states are using SOR dollars for crisis stabilization units, crisis centers, drop-in sites. We know SOR dollars are supporting mobile crisis teams in part, pre-arrest programs. And I agree with Brian, keeping folks out of the criminal justice system is critical. Those dollars are supporting planning and management tools such as service locators and surveillance systems. Ultimately, states are responsible for the system, and you're utilizing innovative strategies to braid funding for 988 and crisis services, but a ton of work remains, and that requires support. So I'm excited to be part of this work. I'm excited to partner with the TA Center, Brian with states, SAMHSA, and I look forward to seeing the neat work moving forward, including the Policy Academy in Arizona. Thanks for allowing us to share some thoughts, and I'll hand the mic back to Jill. Thank you.
Thank you, Annette, Monica, Brian, and Rob, for all of the tremendous information that you have given participants to think about. So at this time, we want to make a shift and turn our attention toward the Policy Academy on Crisis Systems Design that was announced back on December the 20th. And for this, I'm going to turn things over to Tiffany Lombardo, Co-Project Director for the Crisis Response TTAC. Tiffany?
Thank you, Jill, and thank you all for joining us this afternoon. As Jill mentioned, I'm the co-project director along with Adelicia, who opened today's session. And just to echo everyone, thank you all for sharing and talking and participating with us and partnering with us on this initiative for this year. So Monica and Brian and Rob and Jill and Annette all set the stage for me on why these things are important and why we want to offer this. So the application process is open, and we hope that you have received those communications. If not, please reach out to us. But we are hosting a Policy Academy on crisis system design for states, tribes, and territories. And our objective with this is to help states, tribes, and territories in coalition building, role clarity, applications of systems engineering design principles, and to help states, tribes, and territories develop and improve policies and practices in the design of their crisis systems across their regions. Next slide, please. So the Policy Academy, how this will be set up is there's going to be three main components. One is preparation. So that's the orientation to the Policy Academy, which is the webinar today that you are all joining. Once we go through that application process, which is live, we invite you as a state, territory, or tribe to apply and to convene a team within your state as outlined in the application process. We will be reviewing those, and SAMHSA will be selecting 10 to participate. We do hope to offer this again later in this year or into next year. But we will select 10 states, tribes, or territories, 10 teams to participate. There will be 2 virtual technical assistance planning meetings. And this can be open to a large group of your team, large number of people, whoever you would like to include in these planning discussions and in these virtual training and technical assistance support meetings. This will lead to a 2-day in-person intensive Policy Academy convening in Tucson, Arizona on April 1st and 2nd. Each team will be able to have 8 team members travel. All the travel expenses will be funded through the TTAC, through the Training and Technical Assistance Center. And we have a great partner in the JW Star Pass Marriott in Tucson, which is where the event will be held. We will be offering connection to subject matter experts and consultants, and there will be a large, intensive focus on team planning, cohesion, and strategic planning for each of the teams as they move forward beyond the Policy Academy event. Following that, there will be follow-up virtual technical assistance meetings. Again, support connection with experts and consultants as needed based on the needs of and the goals, shared goals of your state, tribe, or territory. And also an in-person site visit by your facilitator. So each team will be assigned a facilitator that will work with them, a TA facilitator that will work with them through the entire process, and to help them keep on track, make sure that we're connecting them to the appropriate resources and making sure that you're meeting your shared goals. Next slide, please. So for the in-person convening, some of the topics that we are hoping to center on are obviously on systems design. Many of these things we've been highlighted in discussion so far already. Funding infrastructure and sustainability with that, obviously. Embedding equity into the crisis system, youth services in our crisis systems, as well as the integration of the mental health and SUD crisis response models. Effective implementation of 988 across the area, the region, and workforce, right? So workforce development, training, recruitment, expansion, what those needs are in terms of having a robust crisis system for your area. And again, the high focus is a team discussion and strategizing, developing a plan, which will be facilitated by subject matter experts and consultants. And you will have that a technical assistance facilitator to be assisting you throughout the full process. So this is an ongoing process. This is not just a one-term event. This has preparation meetings, this has the event, and then there will be follow-on TA and connection to make sure that the shared plan is able to be implemented and that we can assist with any challenges, barriers, or roadblocks along the way. Next slide, please. So the team composition, so each team should be a representative of cross-system leaders, change agents, decision makers, and people with lived experience from your region who can speak to the system design, how it is now and how it can improve and how you want to see it in the future. The travel team will need to consist of only 8 members to attend the in-person Policy Academy. But all of the virtual meetings and follow-on TA again can be open to additional members and representatives that you want to participate. Next slide. So here are some of the required members of your team, including the State, Tribe, or Territory Mental Health Authority, the SSA for substance use, the State Medicaid Authority, a person with lived experience or a parent with lived experience, 988 Center Leadership, mobile crisis provider, behavioral health youth expert, community-based organization, and some representation from judicial or law enforcement. We also have other recommended team members, and I am knowing that this can look different in each state and how each state's systems are structured and how tribes and territories may look differently. So knowing that there may be individuals that wear multiple hats for each team. And if you have questions about who can qualify or if you're having trouble making those connections and your state, tribe, or territory still wants to participate, please reach out to us and we can try to assist you in that manner. Next slide, please. So the application period is currently open. On February 15th, we will we will notify successful applicants that they have been selected. So the application window is through the end of the month of January. So you have a few more weeks to get your application submitted. On March 1st, we will need the final travel team list from you. And that is to make sure that we can make arrangements for all of your travel and that we have the room blocks and rooms assigned appropriately for the in-person convening on April 1st and 2nd, which will be in Tucson, Arizona. So you'll be traveling March 31st. And the event will occur on the 1st and 2nd for travel home, either the evening of the 2nd or the morning of the 3rd. Next slide, please. And so the complete application must include the online form, a completed framework for a self-assessment, and a team roster. The QR code here will link you directly to that application. We also have sent out email sites. You can always reach out to us directly too if you need the link again as well. Next slide. Now we're going to have some of the questions. I've been speeding through this because I wanted to get to your questions and have a few minutes for that. So I'm going to turn it over to my colleague, Alicia. Tiffany, thank you so much for all the information that you provided. Like you said, we're going to turn into a very quick Q&A. I know the webinar ends in 4 minutes, but want to make sure that we address some of the great questions that you either put in the QA box or submitted during the registration process. So the first question is for Brian and Monica. What advice would you give for states who are examining crisis services across multiple work groups and commissions?
I can take a stab at this first, having had to do this work for years. So I think that it's going to sound like a cliche. I do think that collaboration with intention is what's important. So I think there has to be buy-in from the people who can heavily influence, and I'll use the word even maybe require that certain people are coming together to solve for these issues. And so if that looks like a commissioner, if that looks like another government lead within a state system, wherever the levers are, like who makes the final decisions, and then who can hold the different entities that need to collaborate accountable. And so whatever that may look like, and there's so many different versions of how this could play out, but I have found that when you don't have the accountability built into who's supposed to show up, is that person in the position to make a decision? Is that person in a position where they could change a policy? Is that person in a position where they can influence and maybe impact legislation? And so these are key questions. And what I think is starting to happen is you do have it's always, yeah, I used to be a social service tech in a residential facility. It's my first job. We were with the clients the most, like more than therapists, more than the doctors. We were with them the most. We knew a lot, but our influence was not the same, right? And so thinking about who has the influence to really compel, not only say, go collaborate, go partner with, but then is expecting accountability and is expecting some product that moves the system forward. So some kind of way that has to be built in order to even begin to do some of this work. So those are my thoughts from my perspective, Brian.
I'm sorry. The only thing I would add to that, because I agree with Monica saying, is so much of this work is about relationships. And one of the things I found with the policy academies is that there were times that there were people that I knew of, but the policy academy gave me the opportunity to really have an intensive opportunity to talk about an issue that I didn't have in my home state. So that's the only thing I would add. Thank you.
Thank you so much, Director Johnson and Brian. At this moment, we are coming to the top of the hour now. So we are just wanting to, again, thank our guest speakers and Jill Mays also for facilitating this webinar. I know we're sharing some of our information in the chat for upcoming events that we will love to see you there. And thank you for all the participants that have joined us today for your participation. And we'll be looking forward to answering questions via email if we did not get to them. You always can also reach us with any questions. I will ask our comms team to insert our email address as well for any questions regarding the Policy Academy. Thank you so much and have a wonderful afternoon, everyone.